Okay. Okay. And I'm going to open this as well. All right. Hi, everyone. Can everybody hear me?
Yeah.
Okay, perfect. Hi, welcome to today's Pre-Dental Study Club. My name is Niyousha, as you might have seen from the posts. I graduated last year from York University with an honors Bachelor of Science. My major was biology, and I am a pre-dental student. So my presentation is going to be about the basics of orthodontics and its history. Before I get any further, I want to let you know that the link for volunteer hours form will be sent at the end of the session. So make sure to stay until the end of the presentation to get the link, and then you'll be able to get your volunteer hours. Also, the session is recorded, so that's another thing as well. And without further ado, I think we can just get into it. So yes, the name is Orthodontics, about the history, advancements, and impact. So here's a little overview of what we're going to talk about today. We'll start off by defining some terms and how orthodontics helps us, why and when we need orthodontic treatments, why humans need orthodontic treatments, whereas other species don't. A little about the history of orthodontics, the methods that are used, and then we're going to have a little Kahoot game at the end. Okay, so what is orthodontics? So orthodontics is a dentistry specialty that addresses the diagnosis, prevention, and correction of malpositioned teeth and jaws, as well as, okay, I'm gonna let someone in, sorry. The correction of malpositioned teeth and jaws and misaligned bite patterns. It can also address some modification of facial growth. Now, orthodontics is a very vast topic. It takes years and years for dentists to become an orthodontist, depending on their country's system of training. For example, in Canada, you would have to acquire your DDS or DMD degree, and then you can apply for the specialty. And the Canadian Dental Association would expect orthodontists to complete at least 2 years of postdoctoral specialty training after their graduation to be certified. The same or similar thing in the United States. The program generally lasts for 2 to 3 years, and there are several exams that one must take before they can become a certified orthodontist. So a little interesting fact about orthodontics is that it was actually the first specialty to be recognized within dentistry. And the American Dental Association recognized it as a specialty in the 1950s. Okay, so why do we need orthodontic treatment? As we know, we've covered it in other, and my colleagues have covered it in other presentations before. We know that oral health is a window into your overall health. And even though orthodontic treatment is mostly famous for helping us get a beautiful smile, it can address many other health issues as well. Now, orthodontic treatment can help ensure proper function of teeth and a better oral health, as well as alignment of jaws. When you have a good bite, it makes it easier for us to bite, chew, and speak. But if we have a malocclusion, which is when your teeth are misaligned, they put extra stress on your jaw, which over a period of time leads to pain and issues with the jaw. When your bite pattern improves, your teeth will not get worn down, as opposed to if you have misalignment. Also, teeth that are misaligned are harder to clean and can cause some abnormal wearing of tooth enamel or cause decays, which can then lead to extensive and other harder and more expensive dental procedures. Now, getting an orthodontic treatment when one needs it also helps improve gum and teeth health. So when misaligned teeth are not addressed, it can result in gum disease, bone loss, and sometimes it can also lead to tooth loss in extreme situations. And then that is going to lead to, swollen gums, and it can become very sensitive. So you can see that a lot of issues will might happen because of not addressing these issues. Also, orthodontic treatment can help protecting teeth. So for example, the growth of upper and lower jaws can be corrected. It would create sufficient space for natural permanent teeth to erupt. And of course, improved self-confidence and a healthy smile is an added bonus as well. Now, when should we see an orthodontist, and when should we start thinking about it? There are certain concerns and signs that if you notice these, that's when you should start thinking about scheduling a consultation with your orthodontist. So either if you have early or late loss of baby teeth, difficulty chewing or biting, mouth breathing, sucking the thumb or fingers, or other oral habits, if there are any crowded, misplaced, or blocked out teeth, if you have jaws that shift, make sounds, protrude, or are recessed, if you are experiencing speech difficulties, for example, or biting the cheek or biting into the roof of the mouth, or if there are protruding teeth, teeth that meet in an abnormal way or don't meet at all. And if there is an asymmetry in the face, if there is a facial imbalance, features are out of proportion or to the rest of the face, and if one is experiencing grinding or clenching of teeth, as well as inability to comfortably close lips. So these are some of the signs that could potentially signal that one could benefit from using or from starting an orthodontic treatment. Now, is there such a thing as optimal age or an optimal time for getting screened for orthodontic treatment? Now, usually they say that age 7 is considered the optimal age for starting to get screened by an orthodontist. But there are actually 30% of orthodontic patients in America are adults, and in America and Canada are adults, and it can have great benefit at any age. But why do we say that starting at the age of 7 is a good time? Now, by the age of 7, the first adult molars start to erupt, which will establish the backbite. Now, during this time, an orthodontist can evaluate front to back and side to side tooth relationships. For example, the presence of erupting incisors can indicate possible overbite, open bite, crowding, or gummy smiles. Now, if children get timely screening, there is a higher chance that they are going to have better results in the future. Now, this is called interceptive treatment. And here are some of the results of getting interceptive treatment. It can help create room for crowded, erupting teeth. It can create facial symmetry through influencing jaw growth. It can reduce the risk of trauma to protruding front teeth. It can preserve space for unerupted teeth. It can reduce the need for tooth removal in the future. It can reduce treatment time with braces, and overall it's much better because when children are young, or like when we're young, our bones can be aligned more easily, can be can move more easily. So now we learned about when we need it and why does it help us. But there's one question that always fascinated me personally, and that was, why do we need orthodontic treatment in the first place? Like, as a species, why don't other animals need it, or why didn't humans before us need it? So here's a little interesting comparison between the skulls of hunter-gatherer humans and modern industrial humans, which are us. So you can see that they have similar skeletal bases, but the masseter in the hunter-gatherer skull is so much bigger than the one of the modern human. And also the pterygoid muscle is much, much bigger. And one other thing is that the alveolar bone is much, much bigger in the hunter-gatherer humans compared to the modern humans. And all of that has somehow resulted in us having crowded teeth when our ancestors actually were completely okay and had straight teeth. And our wisdom teeth are not very useful most of the time, and a lot of times they're impacted. Whereas hunter-gatherers had functioning third molars. Now, there are a lot of reasons that we believe why this issue has come about. Modern industrial societies have malocclusion, and nowadays there's an estimation that 50 to 70% of US children will wear braces before adulthood. And as it turns out, this is something that has happened through time after our way of life has changed, and after people started to cook and have foods that were softer, and when they started to have instruments and tools that help them cut into foods and make them smaller. And I was actually looking at this piece of writing from someone who worked at a museum, and they said that they work with thousands of ancient skulls from all over the world, and they were saying that the skulls that were from the last few hundred years, they are filled with cavities and infections. The teeth are crowded into the jaw, and about 1/4 of them have impacted teeth. Whereas the skulls of pre-industrial farmers are also have a lot of cavities and painful looking issues, but less than 5% of them have impacted wisdom teeth. In contrast, most of the hunter-gatherers had nearly perfect dental health. And this was a comparison between 146 medieval skulls that showed that 36% of medieval samples had issues, whereas right now in the modern times, 65% of humans have issues and would require orthodontic treatments. Now, yes, so basically, bottom line, our ancestors did not suffer from crooked teeth to the same extent that we do today, and a lot of it has to do with our way of life and the food that we have been eating for the past thousands of years. So at this point, it is already incorporated into our, it has already changed our bones. So I wanted to talk a little about the history of orthodontics. As a modern science, orthodontics dates to the mid-1800s. Now, there are a lot of people who helped build this science and make it to what it is today. But here are two of the field's influential contributors. One of them is Norman W. Kingsley, and the other one, Edward Angle. So Kingsley is actually the person who pioneered cleft palate treatment. Angle, who is actually known as father of modern orthodontics, created the first basic system for classifying malocclusions, a system which is still used to this day. He also created the first school, journal, and society of orthodontics. So he's a pretty big guy in this field. Now, until the mid 1970s, braces were made by wrapping metal around each tooth with, you can see in these pictures, they look pretty extreme and not as user friendly as they are today. With advancements in adhesives, it became possible to instead bond metal brackets to the teeth. So yeah, now they're much more, we care much more about how they look, and we care more about how they look and how comfortable they are. And now we have moved on from these times. And I don't know about you, but this has reminded me a lot of the Tim Burton Charlie and the Chocolate Factory, which was quite memorable. Now, there are several different methods that are used for, by orthodontists to help us have fix our alignment issues. The most famous one, which a lot of us have had, I'm sure, are braces. They're usually placed on the front side of the teeth, but may also be placed on the side facing the tongue. So that's called lingual braces. And brackets made out of stainless steel or porcelain are bonded to the center of the teeth using an adhesive, and then wires are placed in a slot in the brackets, which allows for controlled movement in the different dimensions. Now, apart from the wires, we can apply forces using elastic bands and springs that may be used to either push teeth apart or to close a gap. Several teeth can be tied together with different kinds of hooks and can be placed to allow for connecting an elastic band. Now, the time required for braces varies from person to person. It depends on how severe their problem is, the amount of room they have in their mouth, the distance the teeth need to move and travel, the health of the teeth, the gums, and the supporting bone. So there are a lot of things to consider, but on average, braces take 1 to 3 years to fully treat the teeth to a aligned and to an aligned to achieve an aligned look. After braces are removed, most patients need to wear a retainer all the time, at least for the first 6 months, and then they can move it to only during their sleep. Now, there are also clear aligners, which are really popular now, which are called Invisalign. There are also another form of orthodontics that are very popular today, because a lot of us don't like the appearance of the metal braces. These can really solve that issue, and they have a more secret look. And there are a lot of controversies about whether they are effective or whether they're as effective as the traditional ones. But nowadays they seem to be working pretty well. And here we also have headgear, and I actually had a less extreme, but a modern version of this, which was a look. You should have been there. And orthodontic headgear is a treatment it's a treatment approach that requires. Sorry, is my internet saying it's a little unstable? You guys hear me okay, right? I think it's fine. Okay. Okay, perfect. Thank you. orthodontic headgear is a treatment approach that requires the patient to have a device strapped onto their head to help correct malocclusion. It's typically used when the teeth do not align properly. Headgear is most often used along with braces or other orthodontic appliances. Now, while braces correct the position of teeth, orthodontic headgear is most often added to the orthodontic treatment to help with aligning the jaw, and it is most effective for children and teenagers because their jaws are still developing and can be easily manipulated. Now, there's another method that is sometimes used, and that is palatal expansion. It can be achieved using a fixed tissue borne appliance. There are removable appliances that can push teeth outwards, but is less effective at maxillary sutural expansion. Palatal expansion can create more space for teeth as well as improve both oral and nasal airflow. And in more extreme cases, there's jaw surgery, which is sometimes required to fix severe malocclusions. And in this method, the bone is broken during surgery and is stabilized with titanium plates and screws to allow for healing to take place. And after the surgery, the regular orthodontic treatment can begin, and the teeth can then be moved to their final position. Now, post-treatment, you would still need to care for your new achieved smile. Now, after orthodontic treatment is completed, there's a tendency for teeth to return or relapse back to their pre-treatment positions. To prevent relapse, the majority of patients will be offered a retainer once treatment has completed. Now, most of us would get the removable retainers, which are the two bottom pictures that you can see here. One of them are, the bottom one is the classic one with the wires, and then the middle picture is the invisible one, which a lot of people use now. And you can also have fixed retainers, which are the above picture. Now, the removable retainers are either made from plastic or they're made from wires, as I just mentioned. And they will be worn for different periods of time, depending on patient need to stabilize the teeth. Now, fixed retainers can be made in different ways. Sometimes there are simple wire fixed to whatever part of the mouth that the doctor considers necessary. There are, they can be either labial or lingual braces with brackets fixed to the teeth. Now, one thing to consider is that orthodontic treatment is not a quick fix. It is a complex biological process, and it involves changes in jaw bones, facial bones, and soft tissue as teeth are moved into their new position. So the patient would need to take care of their teeth along the way. So they would need to be very careful, with brushing, with flossing, and all these things, so that the end result is something that they were looking for. And working with their orthodontist, it can end up looking really good. And so that is the end of my presentation. And here we have a Kahoot game. So I'm gonna just someone just joined. Wow, I spoke much faster than I wanted. Okay, I'm going to start the Kahoot game, if it works with everyone. Okay. Here's the game pin. Okay, 9154315. Okay. All right, thank you, Precious, Maria, and JS. It's only 5 questions, so it's pretty easy. Yay, hello. Oh, hi. Okay, so let's see how many of us wanna do this. Is there anyone who wants me to wait a little? Or are we good? Okay, I'm gonna go ahead and start. All right. What do you know about orthodontics? That's the name of the game. What is the optimal age for visiting an orthodontist for initial screening? Yay, everyone got it correctly. Good job. And the next question, are you ready? Oh, yay, good job, JS. What percentage of population could benefit from an orthodontic treatment? Did I even mention this? Did I not say it? Oh, good job. Guys, I think I didn't even mention this, but yes, the answer was 50%. And now again, JS is on top with Ida and Maria right behind. Here's a true and false. Orthodontics was the first specialty to be recognized within dentistry. True, yay, good job. What's true media? Okay. Good job. You have a streak, JS, with 3 correct answers in a row. And here's the 4th one. What are some benefits of an orthodontic treatment? All of the above. Yay. You love that. Okay. And here is the last question. When did orthodontics as a modern science start? Oh, wait, which one did you guys answer? 1950s? Oh, 1950s was when American Dental Association considered it, accepted it. Oh, yay, Ida, number 3. Maria and JS. Woo. Good job. And runner-ups, Precious and Kareem. Thank you so much for playing the game and also for listening to me. I wanted to mention that you should definitely fill out the volunteer hours form. And I'm gonna send the, is it okay if I send the form, sorry, the link in the chat?
Yes, absolutely.
Okay.